We've been doing the joint inspection of all health facilities in the Coast region, not just in Mombasa County. Part of the exercise that was launched by the Cabinet Secretary for Health, a rapid response initiative to ensure that both the public and the private facilities meet the health standards that have been set by the ministry to be able to provide the health care that is needed by Kenyans. We have observed that at the national level that there has been lots of complaints from the patients all over the country regarding the quality of care that is being provided in hospitals, in clinics, and even in chemist outlets. And this exercise is intended to last 90 days to ensure that we inspect all hospitals, all nursing homes, and all the clinics, all the chemists that are, and the laboratories that are providing services to Mwananchi, and to ensure that they meet the standards that have been set to provide services for Kenyans. We visited this facility on Tuesday, the 14th. We inspected this facility, but we observed that it did not comply with the standards. We noted that the quality of care that is being provided here is not very good, or it doesn't not meet the standards. In the regards that that some of the personnel who are providing services here were actually not qualified, or even if they were qualified, they were not licensed to practice. And number two is that the infrastructure for the laboratory, the infrastructure for the pharmacy was actually below standards. But we also observed that the waste management and disposal systems actually are still below the standards. In fact, I would say that the waste disposal mechanism is not there. Again, we also noted that the theater that is being used in this facility is actually a 10 by 10 room that opens direct to the general ward. And therefore, this is not the standard theater that is required in a facility like this. And therefore, with those non-compliance issues, we actually gave out a closure notice to this hospital on Tuesday. However, we came to realize, or it was reported to us, that there was another notice that was put outside the facility indicating that the facility has been closed for renovation. The facility was not closed for renovation, but the facility was closed due to non-compliance. And that is an illegality on its own. So we had come here to confirm the same, and also to confirm that this facility actually remain closed, because one of the challenges that we are trying to address is on ensuring that the facilities that we close remain closed forever. I just want to assure the Kenyans that this exercise is going to continue, not just for the 90 days, but it's going to be every other time to ensure that facilities comply. It is not a one-time off exercise, as it has been, but this time around the government and the Ministry of Health, through the various regulatory bodies, is going to ensure that Kenyans are able to access services. We have 10 teams in the entire country. This is only the team which is in the coastal region. They started with the Kilifi. Kilifi, they inspected 127 facilities, and 10 of them were closed. Yesterday, on my way from Kilifi, I also passed through Mutwapa. I inspected the chemists there, and I closed 11 chemists because either they did not have the qualified personnel or they did not have the license that is needed for them to practice. So this is an exercise that is going to go on throughout the country. Thank you.